Okay, okay.
All right. Good evening, everyone. Hi, Jessica. Good evening. I can see you. Sadia, I can see you. You're very welcome to tonight's live. We are so sorry we are starting 5 minutes late. If you can hear us, please can you put a comment? Can you put a comment if you can hear us and you can see us? Please let us know. I know that I can see Jessica on the live and I can see Sadia on the live. Thank you so much. I can also see that 8 people have joined the live. So please, can you let us know if you can hear us? All right. Hi, Zubaina. I can see you. Okay, great, Jessica. Good to see that you can see and hear now. Thank you very much for joining in. If there's anyone here that can still hear and see us, please let us know. All right, you're very, very welcome. Hi, Nurse Kede Obetin, loud and clear, good evening. Beautiful. Mariam Ibrahim, thank you so much. Sadia, I'm glad you can hear and see now. Thank you so much for joining us. I can see familiar names. I know that during last webinar, who are Jessica joined us. And I want to say thank you again for joining us once more for our third edition of the Health Talks. Thank you so much. It shows that you are enjoying what we're doing here and you decided to do it with us again. My name is Christine Vihishima. I am the programs officer at Well Life Foundation, and it is my pleasure to once again be doing this with you. So far, we have been able to do 2 health talks, and today marks our third health talk. We are going to be learning about endometriosis and all we need to know about it. And our executive director, Dr. Ibrahim Yakub Sime, is going to be our facilitator once again. If you attended any of our webinars, you will know that you are learning from the very best, and we believe that you have an exceptional time. As always, if you have any questions, you can feel free to post it in the comments. I will be here to moderate and ask our good doctor the questions at the appropriate time. So you can drop your questions once they come to your mind, and I will refer them to him. Once he is done with his presentation, sit tight. We have a very, very wonderful time. Very, very wonderful content in store for you tonight. And I want to assure you that you are going to have an exceptional time. Thank you for subscribing to our channel. If you have not subscribed, this is your cue to subscribe, because trust me, it only gets better from here. Aside using YouTube to stream our webinars, we intend to also launch many other educative content on our channel just for you. And we know that it's only going to get better, like I said. So without further ado, and before I introduce the doctor to join us, I'd like to encourage us to connect with Well Life Foundation on our social media handles. We are very, very active on Instagram and Facebook. Just search for Well Life Foundation and you will find us right at the top. Remember that we're here to assist you on your health building journey, and we know that with all of the things that we are sharing with you, you will do better on your journey to good health and wealth. All right, at this point in time, without further ado, I will be passing over the mic and handing over the stage to Dr. Ibrahim Yakub Sime, who will be facilitating tonight's session on endometriosis. Do sit tight, stay tuned, and see you at the end. Over to you, sir.
Okay, thank you very much, Christine, once again. You're welcome, everyone, wherever we are. As Christine said, in at Wildlife Foundation, we are attempting to, as much as possible, give health education. Of course, that's not the only thing we do. We approach health needs of people at different levels. We do preventive health, and in preventive health, education is very important. And so this series of health talks are meant to fulfill that obligation of ensuring that as much as we can, we give health talks on various topics relating to human health. Of course, this is just our third episode. We're going to be doing a lot more by the grace of God. So today, we're going to be talking about endometriosis. I guess many people may have heard about endometriosis, but I understand that I do know that, of course, a lot of people, except if you are medically inclined or trained, you may not clearly understand what endometriosis is. But it's quite common, as you can see as we go along. So we're going to be talking about endometriosis hopefully in the next few minutes. I hope we can see my slides, and I'm going to be talking about it in this format. We're going to be looking at the background information on endometriosis. We're going to try to define what endometriosis is so that to our level, to our understanding. I mean, it's not necessarily, we're not going to define it as medical professionals would, but we'll try and explain it the way we believe people may understand. Then we'll look at what are the things that can cause endometriosis. Then what do we feel when we have endometriosis? In other words, symptoms. Then how do we know any lady or individual has endometriosis? That's the diagnosis. And then we come to the treatment. Then how do we prevent? And then at the end of the day, if there are questions or comments or additions from our guest, then of course we'll respond to them. So endometriosis, it's a disease that affects women in their reproductive age, the age between 15 and 45. However, it is more common around the ages of 20 to 35. Now, the reason for this is because the main hormone that controls the growth of this particular tissue called endometriotic tissue is only present in the lady in this age group. Usually before the age of 15, on the average, or before the age of menses or commencement of menses, we hardly can talk about diagnosis of endometriosis. And then after 45, and particularly after menopause, we hardly see endometriosis. So it is a disease of reproductive age. It affects women. 1 out of every 10 women, or women rather, would have endometriosis. What it means is that if you have a gathering of up to 10 women in their reproductive age, 1 out of those 10 women will have endometriosis. That's how common it is. You can imagine, therefore, how many women all over the world would have endometriosis, or they're dealing with endometriosis knowingly or without knowing. It's even more common among women who have infertility because it's one of those things, those medical conditions that can be associated or may be associated with infertility. And in women who suffer infertility, we have 5 out of every 10 women having endometriosis with infertility. The other thing about endometriosis is that it may run in families. In other words, if your mother has endometriosis or your direct siblings, ladies, sisters have endometriosis, it's more likely that you may also develop endometriosis because there seems to be some inheritance or genetic inheritance in the development of endometriosis. So it runs in family. Now, one very frustrating thing about endometriosis is the fact that it's progressive. What that means is that once it starts, it progresses up until when that is, it gets worse, up until when the lady gets to menopause, or if along the line there's any form of treatment. So, how do we define endometriosis? Well, in my next slide, I'm going to demonstrate what I'm going to say now in this slide. Endometriosis means there is the inner lining, the tissues of the inner lining of the womb, which is called endometrium in other parts of the human body. That's basically what it means, meaning that that part of the lady that sheds every month, okay, as menstrual blood, is also present in other parts of the body. And we're going to see the other parts of the body where such tissue may exist. What it means, therefore, is that as the woman is menstruating, as we're seeing blood coming out, she is also, so to say, menstruating in other parts of the body. So what the endometrium is, I'm going to show in our next slide. Now, this diagram is just aimed at trying to give us an idea of what we're talking about. Most of us who are not medically inclined, whatever it is that you are presently studying or doing, somewhere along the line, I believe, somewhere in secondary school or maybe primary school, you will have come across this diagram in studying the reproductive system of a woman. And in this case, we have this structure here that is called the uterus, or commonly known as the womb. This is the womb. This is the diagram representing the womb. And by the sides of the womb, we have these tubular structures called fallopian tubes. And then we have both on the left as well as on the right. Then this womb was sliced in a way that the inside of it could be shown. So this brown area here is the inside of the womb, or the inner lining of the womb, that sheds every month as menses. So endometriosis, therefore, means that apart from its presence here, it also present outside of this environment. And this is depicted here. This is here. This is outside of the womb itself, though sitting on top of it. Here is similar example. Here you can see some intestine here, and we have endometriotic tissues there. Here it is on the tubes. Here it's very close to the neck of the womb. Behind here we have something we call bladder, where urine collects, and we have some endometriotic tissues there as well. Now, here is the ovary, and we can also have endometriotic tissues within or on the ovaries as well. So these are the various places where you can find endometriosis, and the next slide will give details of that. So, as I said earlier, where can we find endometriosis? We can find them in the ovaries, as we saw in our previous slide. In the ovaries, they can either survive on the surface or within the ovaries themselves, in which case, every month the woman menstruates, she also menstruates, so to say, within her ovaries, and ultimately, the blood that collects there doesn't come out. And so it becomes something we call cyst or endometriomas. They look like chocolate cyst. The content of the cyst is almost exactly like chocolate in color. So that is endometriosis in the ovaries. We have endometriosis sometimes on the fallopian tubes, as I showed us in our previous slides. Then we also have endometriotic tissue, sometimes in the intestines, on the bladder, sometimes in the lungs. I have personally seen and managed patients with endometriosis of the lungs. I've also seen patients with endometriosis in the brain, where the patient every month develops headaches. Depending on the severity, sometimes they actually may convulse. Then we have endometriosis in the skin as well. As the woman bleeds during her menstrual cycles, there are some spots in her or on her skin that bleeds as well. Particularly very common is endometriosis in the belly button, that is the navel. I've seen patients and managed patients that have endometriosis of the belly button, such that every month as they bleed through the genital tract, they also bleed in the inside of the belly button, to the extent that at some point you see the belly button looking very dark and painful, of course, during menstrual cycles. Then we could also have endometriosis in the anal area, in the anal canal, and women or ladies who experience this usually complain of severe pain when they are passing stool or when they're defecating, and usually this pain may be associated with bleeding from the anus, and particularly if this is occurring around the menstrual periods, that could be endometriosis of the anal canal. Again, this is just to again show us the types or the areas in the body where you can have endometriosis. Okay, this is a woman whose body is sliced from side by the side. We call it coronal view. And here we see the womb here. The normal place where endometrium should be is the inside of the womb here, depicted here. But in this case, the red spots here indicate where outside of the interior of the womb we have endometriosis. Here, this is the bladder. Inside of the bladder, we have endometriosis. And in this person, in our patient, what the symptoms she may experience will be every now and then, especially during her menstrual flow, she may be experiencing blood in her urine. And the blood can be frank blood or blood mixed with urine, depending on the severity of the tissues or the amount of tissue or endometriotic tissues that is found in the bladder. So that is possible. Here we have endometriosis in her ovaries. Here is somewhere around the belly button. Here is the rectum, that is the part of the intestines where feces collect. So it can be just about anywhere else in the body, as we said before. Now, what are the things that can cause endometriosis? Endometriosis, just like any other most medical conditions, uh, the cause is largely unknown. What it means is that we do not know directly why some women would have endometriosis and others don't have endometriosis, yet they have similar body functions, organs, and hormones. And yet some people would not develop it while others develop endometriosis. So, however, there are theories, okay, that attempt to explain endometriosis, as it were. In other words, things that seem to predispose one particular woman to developing endometriosis against the other person who may not develop endometriosis. We said in our introduction, it will run in family. In this case, we call it familial or genetic. What it simply means is that there seems to be some degree of inheritance of endometriosis. And so if your father, I mean, your mom or your sisters have endometriosis, you are more likely to develop endometriosis during your reproductive years as compared to another lady whose parent or whose mother or siblings don't have endometriosis. Then retrograde or reverse menstruation. The other theory that tends or attempts to explain endometriosis is the process whereby, as a woman is menstruating, here we have the uterus here by the side here. Now, usually menstrual flow is supposed to come down here and then outside. Now, reverse menstruation means that some of the blood that is coming down here, that's supposed to come here, goes back towards her tubes and then drops into her tummy and other places. And thereby, the fluid around the tummy now transports the endometrial, the menstrual blood, so to say, that contains the endometriotic tissue to other parts of the body. And that is one second possible explanation as per the causes of endometriosis. It is called retrograde or reverse menstruation. Then there's this thing called transplantation theory, whereby, well, in the process of operations, let's say a woman is probably undergoing fibroid surgery or any surgery at all, including cesarean deliveries or any surgery that would demand or require that the woman's womb is entered. So sometimes accidentally, the doctor may pick up some of the tissues from the inside of the womb and then accidentally seat them or plant them in other places within her abdomen. And thereby, once that tissue gets blood flow from anywhere else, then it grows as endometriotic tissue. That is what is called direct transplantation during surgery. Then the last but not the least is blood spread. Well, it is also suspected that Perhaps endometriosis, especially endometriosis that are present or that is present in distant organs far away from the womb. For instance, the brain. How does the brain get endometriotic tissue? How does the lungs get endometriotic tissues? The theory here is that perhaps some of the tissues from here during menses, because blood vessels during menstruation are opened, and some of the tissue, instead of falling out, may fall into blood circulation, and through the blood circulation, it can go anywhere, it can reach any part of the body and get seeded there and grow as endometriosis. So these are the various ways by which endometriosis is thought to develop. However, as I said, these are just theories because practically it's not every woman who develops retrograde menstruation that may come down with endometriosis. There are more technically advanced explanations to this, which we don't have to bother ourselves about for now. Now, what are the symptoms of endometriosis? The commonest symptoms, the commonest thing that ladies who have endometriosis suffer is pain. And this pain has a particular pattern, could have a particular pattern, or sometimes not. But most commonly, the commonest uh, symptoms is pain. This lady here, for instance, I mean, it's it's obvious that she's in some kind of pain. In this case, it's pelvic pain, deep pelvic pain, especially associated with her menstrual flow. During menses, you see ladies in severe excruciating pain, and that is one of the signals that suggests that she may have endometriosis. As we said before, 1 out of every 10 ladies, okay, in their reproductive age may be suffering that. So menstrual pains and severe. Now, the severity of pain, of course, depends on individuals, okay? It could be one of the signals that suggests that the lady may have endometriosis. Then pelvic pains. Outside of menstruation, some women whose endometriosis is very bad could also experience persistent pains in their pelvic area. Almost always they're in pains, and that could signal endometriosis. However, of course, there are other causes of pelvic pains in women, but endometriosis is certainly one of those things that could be associated with long-standing pains in the pelvis of a woman. Painful intercourse is another characteristic or symptoms that may come up with endometriosis. And so usually the woman will tell you that they have severe pain during intercourse. We call it deep dyspareunia. Bleeding in other body parts during menstruation, I mentioned this earlier. Sometimes you see women bleeding in their belly button, or it may not be frank blood, but the belly button gets dark every menstrual period, or some spots in the body, on the skin, or somewhere else could just get dark during menstrual period, then gets lighter as the menses stop, so that you may not see frank bleeding, but just discoloration or changes in skin during around her period. And so that could be endometriosis. Anal bleeding sometimes can come up, especially during periods. And then some women may experience blood in their urine during their periods. Okay. And that could suggest endometriosis. Infertility is another very common problem associated with endometriosis. As I said, up to 5 out of every 10 women suffering infertility may be suffering endometriosis. In other words, endometriosis is very commonly associated with infertility, and the reasons for that are not things we want to bother ourselves, but they're quite technical. Uh, One thing interesting about endometriosis is that the symptoms, that is, the degree of pain, the degree of infertility, or any other symptoms associated with endometriosis, does not necessarily correlate with the severity of the disease. What this means is this: if you remember the slides where I showed us areas where endometriotic tissues can be present, medically there's a way we grade endometriosis from stage 1, 2, 3, 4, or mild, moderate, severe endometriosis. Now, based on the widespread, how widespread the tissues are, Now, you could see someone who is in grade 4 endometriosis by virtue of the spread of the tissues, and yet she may not suffer as much pain as someone else who probably is in grade 1 endometriosis. So reasons for this are not very clear, but of course it's good we know this because sometimes during diagnostic procedures, it is important to know that even if you have one endometriotic deposit somewhere and you're having pelvic pains, as compared to someone who has maybe 10 deposits, your pelvic pains may be worse than the one who has 10. And so it does not necessarily correlate with the disease symptoms. I've shown us this before. Now, how do we know? How do we know when a lady has, or if a lady has endometriosis? The diagnosis is very precise. It has to be done by opening and seeing. Unfortunately, most diagnostic modalities cannot diagnose or cannot see endometriosis. But there are a few things that we use to make diagnosis of endometriosis. Of course, number one is the fact that the symptoms must be there first. However, there are women who may have severe endometriosis in terms of the spread of the deposits in her body, and yet she may not have any symptoms at all. And so sometimes we don't really rely entirely on symptoms. And by the way, there are other conditions that could also mimic endometriosis in terms of symptoms. So there's a specific way we can know if a woman has or a lady has endometriosis. And this is either you open what we call surgery, is either open or laparoscopy. Open surgery means, well, where the facilities are not available for the doctors to do what we call laparoscopy or pinhole surgery, you just open and see. And when you open, you could, if you know how they look like, how they appear in the tummy, you can actually identify them as endometriosis. So that is what we use to diagnose. Surgery is the way we diagnose it. Laparoscopy is a pinhole surgery, where in this case, as depicted in this diagram, we can see the doctor here holding a camera or what we call a telescope or laparoscope, and this camera is inserted through the woman's or the lady's belly button, and through the light source we can actually see the interior of the womb and then the surrounding areas. So if there are endometriosis, this is actually the very best way we can see it, and that is the gold standard in diagnosing making diagnosis of endometriosis. So ultrasound scan sometimes may suggest endometriosis, but it can be a bit difficult using ultrasound scan. The much you can see with ultrasound scan is if the lady has endometriosis in her ovaries and she bleeds every now and then inside the ovaries, you could see chocolate cysts within the ovaries that may suggest that she has endometriosis. We call those cysts, those type of cysts, endometriomas, and they have a characteristics that doctors use to know whether this is endometriosis or not. So, but by and large, the most important diagnostic procedure is surgery, which could be either open or laparoscopy. How do we treat endometriosis? I must say this. I had mentioned in the earlier slide that endometriosis is a progressive disease, and when it starts, it doesn't usually stop until, for some reason, the source of the hormone that is causing it or associated with it is removed. In this case, estrogens. So, how do you then manage? Most of the times, we only manage the symptoms of endometriosis because cure specifically is for when we aim at removing every source, everything within the woman, especially the reproductive system, the ovaries in particular, and the womb that produce the hormone, and then the endometriotic tissue. So painkillers, of course, that's the commonest thing we do. Uh, when a woman has endometriosis, as I said, most commonly it is pain that comes up first. For those who have pain, painkillers in various forms are what we use to manage it. And most ladies who have endometriotic associated menstrual cramps, I'm sure they know that there are a couple of painkillers they probably are used to getting across the counter to use. So, but we must note that painkillers do not in any way cure endometriosis. They are just managing the pains as long as the pains last. It becomes more frustrating when the pains outlive your menstrual flow. You can't be, painkillers throughout your life. So hormonal drugs are the only, are the other ways we manage them, especially where painkillers don't seem to be working, or where the patient, the lady suffers endometriosis all through, and especially associated with pains. So we use certain hormonal drugs to try to suppress the endogenous hormone production of estrogens. And so we use contraceptive pills, we use other things they call progestogens, danazol, and the rest of them. For us, I won't bother us. These are just a couple of hormones that are used to treat or manage endometriosis, depending on what we want to achieve. Then surgery, we have two types of surgeries. Now, surgery can be done for women who still want their fertility to be preserved, okay, and then for those who do not need fertility preservation. Now, for those who need their fertility preserved, what is done is called conservative surgery, where we do laparoscopy. Laparoscopy is that pinhole surgery I had shown us the slide on before, where a camera is put through the belly button, and through the camera, we're able to see or visualize the endometriotic tissues. And then in the same sitting, following the diagnosis, we burn them. We call it laparoscopic ablation of endometriosis. So this, to some extent, can ameliorate the patient's symptoms or whatever symptoms they are for a while. But of course, we should note that sometimes following such burning of the endometriotic tissues, after a while, some may regrow, and sometimes we're not really able to reach every part of the body where endometriotic tissues are. Okay, and so sometimes this does not entirely remove the patient's symptoms, but at least to some extent, they can improve her life for a while. Then definitive surgery is where the source of the endometriosis as well as the source of hormones feeding the endometriosis are removed. That is removal of the ovaries. In this case, the ovaries are the tissues that produce the hormones that feed the endometriotic tissues. Then we remove the tubes and then they remove the womb. Of course, the endometriosis itself arises from the inner lining of the uterus. So when all of these structures are removed over time, even where endometriosis is present in distant places outside of the or far away from the uterus, we see the patient getting better. By the way, I mentioned earlier that no matter how bad endometriosis is, by the time the woman gets into menopause, because by menopause or at menopause, the ovaries stops producing those hormones that feed the endometriotic tissue, and therefore the woman gets relief from her symptoms associated with the endometriosis. Now, the other thing that endometriosis will cause, we mentioned earlier, is infertility. And for some endometriotic women who are suffering endometriosis, especially those whose endometriosis is giving them infertility, we can offer them IVF. But I must mention here again that in some cases, IVF failure rates are higher in women with endometriosis as compared to women who do not have endometriosis. And the reason is that somehow endometriosis can, especially where the endometriosis is present in her ovary, it can actually affect the quality of her eggs, and therefore it is going to be associated with less quality embryos and then perhaps IVF failure. So this is one thing everyone who has endometriosis should note. How do we prevent endometriosis? Well, again, because we know we don't have the direct cause-effect relationship, we don't know precisely what causes endometriosis, so we can't precisely tell, okay, avoid so thing, you will avoid endometriosis. So, but there are factors that seem to improve or reduce your risks of developing endometriosis, or things that can reduce the spread or the severity of the disease, even where you have it. And some of these things are highlighted here. First, avoid alcohol and caffeine. What alcohol does is that alcohol seems to reduce your liver's capacity to metabolize, in other words, to break down estrogen. Estrogen is that hormone that feeds endometriotic tissue. So the more alcohol you take, the more caffeine you take, the less you are able to break down estrogens, and the worse your endometriosis may get. And so preventing intake of alcohol may help you greatly. Now, for don't postpone childbearing. Now, this is important because interestingly, I'm sure for some young ladies who have had endometriosis will realize, especially endometriosis associated menstrual pains, when you start childbearing early, you just see that endometriosis seems to get less and less and less up until the time it just disappears. The reason for that is this: during every pregnancy, during every pregnancy, you tend to burn endometriosis because we have a lot of the hormone called progesterone, which does not encourage endometriotic tissue growth. And so every cycle, every pregnancy seems to burn out endometriosis. The other reason why it's important to get pregnant early or to start childbearing early is this. I mentioned earlier that endometriosis is a progressive disease. So the more you wait, right from the time you start having menses, the longer you take, the worse the endometriosis may get if you don't start childbearing. And of course, the more likely that it may even affect your fertility with time. And so it's important that uh, childbearing is started early. Healthy diet, of course, will help you. High fiber, low sugar can help with endometriosis pain, particularly low sugar diet. I'm sure these days we hear commonly that sugar is associated with pain. Some people actually will tell you that anytime they take sugar, anything that is sugary, simple sugars, their menstrual pains become worse. This is actually very real because sugar, or glucose as it's called in the science, is also associated with, we call it a pro-inflammatory molecule. It also may be associated with a lot of pains. And so for those who have endometriosis, it's important to limit, or in fact totally avoid taking sugar. That will help you greatly. Maintain healthy weight. Of course, the heavier you are as a woman, the more likely that each fat cell in you produces estrogen, and the worse your endometriosis may get if you have endometriosis. And so maintaining healthy weight will help you greatly to reduce your symptoms and improve your life with endometriosis. Then regular exercises. Of course, in everything in health, exercises almost always will improve your health generally. In conclusion, there is a short video we'll play, and then just to summarize the effect and what endometriosis is and what we have just talked about on endometriosis. Christine will play that, and I guess, Christine, over to you, please, if you can hear me.
Thank you very much, sir. I can hear you. So I'm just going to be sharing my screen now, and we would see a video. Just stay tuned. All right, please, can you confirm that you can see a video about to be played on your screen? I'm about to press play. Doctor, can you see
Yes,
my
please.
screen?
Yeah,
Okay,
yes.
great. All right.
Where to the lining of the
So,
uterus grows outside it.
Sorry, sir, can you hear the sound from the video?
No, I can't really. I had before, but I can't hear it now.
Okay, no, I paused it. I wanted to be
Okay,
sure if I
okay,
should.
please. Yes, I can. Yes, yes.
Okay, so I'll restart. I will
Yes.
restart the video.
Thank you. I can hear the sound. Well, I don't know if anyone can hear it, but basically, this video is showing us the various places where endometriosis can be found. This is a 3D rendition of what we're trying to talk about. This is the womb, and then
Is
you can see
and help
endometriosis in
is
different.
available. Endometriosis. Understand it. Advocate for yourself. Seek care.
All right, so sir, I will show the video one more time. It's actually
Okay.
playing. It's actually playing. We can hear it from this end, but I'll play it one more time.
Okay, please.
Endometriosis. The invisible pain many women face. It occurs when tissue similar to the lining of the uterus grows outside it, often on the ovaries, fallopian tubes, or pelvic walls. This tissue responds to hormonal changes, causing inflammation, scarring, and severe pain. Symptoms include intense menstrual cramps, chronic pelvic pain, and even infertility. Yet it often goes undiagnosed for years. The good news? Awareness and treatment can improve quality of life. Endometriosis can be managed with medication, surgery, or lifestyle changes like stress management and a healthy diet. Your pain is real and help is available. Endometriosis. Understand it. Advocate for yourself. Seek care.
All right. Thank you so much, sir. So we have a question in the comments.
Okay.
All right, we have a question. We have one question in the comments. Thank you everyone for joining in. It's been a pleasure having you. We've seen great numbers tonight and we are happy to have you. So there was a question earlier. Um Firdaus is asking, could someone have severe menstrual pain but it won't be endometriosis? That's the question.
Okay. So should I take them one by one, I guess?
Yes, sir, you can go ahead. Okay, so this is the
Okay.
only question we've seen for now. I'm waiting to see more
Okay.
questions.
Yes, yes, of course, there are situations where a lady can have severe menstrual pains and it may not be endometriosis. One of them is menstrual pain that we call primary dysmenorrhea. It's also very common among young ladies who just have rather severe menstrual cramping, but it's not endometriosis. The difficulty here is in differentiating which one is due to endometriosis or which one is primary dysmenorrhea. Because, as I said, it's a disease of reproductive age, and then unless diagnosis is made through surgery, you can't be too sure whether the pain the young lady is suffering from is due to endometriosis, or I mean the menstrual pain, or it's not due to endometriosis, could be other things. Now, for older women, especially with ladies in their 30s, they also develop another situation that is called adenomyosis. Adenomyosis can also cause very severe menstrual cramping, and in this case, adenomyosis is almost like the younger sister to endometriosis, in which case the endometriotic tissue is now embedded within the wall of the womb itself. And so every time the woman is bleeding, she also bleeds. And in other words, almost like the womb is getting soaked completely with blood. So that is another condition. It is called adenomyosis, but it also usually comes up in the third decade of life as compared to the other type, that's endometriosis, that will start earlier in life and the rest of them. So yes, in fact, sometimes you could have chronic PID, that is infection in the pelvic area, that can also cause severe menstrual cramps. So the answer to that question is yes, indeed, you can have severe menstrual cramps without endometriosis.
Thank you very much, doctor. So we have one more question that has come in. And the question is, what's the difference between endometriosis and endometritis?
Okay, the difference between endometritis and endometriosis is this.
Metriosis, yes, sir.
One, yes, endometritis is an inflammation in the interior of the womb itself. This thing that we're talking about that is called endometrium that sheds every month, when it is swollen within the womb itself, usually as a result of infection. That is what is called endometritis. Endometriosis, however, it has nothing to do with inflammation directly. It is just the presence of that endometrium in other parts of the human body outside of the uterine cavity. I hope that just explains it.
All right. Thank you, sir. So we have another question that is almost similar to the last one. But this one now is asking the difference between endometriosis and PCOS.
Okay, well, endometriosis, as we have said, is just something that has to do with the presence of endometrial tissue in other part. PCOS, however, is a disease of the ovaries, not the womb. Okay, and in which case, in the case of PCOS, is the ovaries that are affected, whereas in endometriosis, it is the womb, or rather the presence of the tissues of the womb in other parts of the body. So they're completely and entirely two different disease conditions. The only place where they meet, so to say, it's where infertility, at the level of infertility, because PCOS also can be associated with infertility. But one thing with PCOS, however, is that PCOS is usually not associated with any pains, menstrual pains in particular. Okay, when PCOS causes menstrual pain, maybe it's because the lady is bleeding very, very heavily. Otherwise, in most cases, PCOS is silent. It's a disease of the ovaries. It is not disease of the womb or lining of the womb, as it were. I hope that is clear.
Okay. I believe that is clear. We're having very good feedback from our attendees. Thank you so much for all of the good feedback. So we'll take one more question and then we will begin to wrap up. But before we take the question, if you can see our screen, you can contact us through any of the details on the screen. You can engage with us on social media. Our website is www.welllifefoundationng.com. You can email us at welllifefoundationng@gmail.com. You can follow us on Instagram at welllife_foundation. And on Facebook, just search for Well Life Foundation with a hyphen in between well and life, and you will find us on Facebook. We're very, very active on our social media handles, and there is more health education on our pages going on a daily basis. You can also keep track with us as we conduct our community service interventions and all the amazing things that we do as an organization. Thank you so much for the feedback. I can see good feedback from Mujiba, from Benjamin, Cynthia, from Mariam, and many other people. Thank you so much for your feedback. All right, sir. So we have questions coming in. So the next question says, what's the difference between fibroid and endometriosis in terms of difficulty in conceiving? So I don't know if you understand
Okay.
where
Yes,
this is
yes,
coming.
yes. It's clear.
Yes, sir,
Yeah.
go ahead.
Well, of course, perhaps one of these days we're going to be talking about fibroids as well. But
Okay.
in terms of difficulties in conceiving, I would say that perhaps endometriosis may be worse than fibroids because, except of course, each one of them is unique in the way they may prevent or they may cause difficulties in conception. Fibroids generally are not said to prevent conception except and unless the fibroids are situated in places where they either block the tubes or they prevent implantation of the embryo in the womb. So that's the only situation where fibroids may be affecting your fertility. Otherwise, generally, most fibroids are innocent. They don't cause anything. Endometriosis, on the other hand, the way it affects fertility in two different ways, so to say. One is they tend to create what we call adhesions. If you watch the video, towards the last part of the video, you see some spider web like things around the intestines, around the womb, and all of that. So these adhesions tend to affect tubal movements and then the capacity of your tubes to pick your ovary and all of that. So that can cause infertility or difficulty in conception. The second way endometriosis will affect your fertility is by directly affecting the quality of your eggs. Okay, fibroids don't affect the quality of your eggs. Fibroids, yes, they can also block tubes, but in most cases, they are not as bad. They don't cause as much problems as endometriosis will cause. Yes, as far as fertility is concerned.
Right. Thank you so much, sir. So I think there's one more question I saw somewhere. Yes. So it says, um, can endometriosis cause uterine blockage?
Okay, I guess maybe what she means or what the person means is a tubal blockage.
Okay.
Generally, interestingly enough, endometriosis don't cause tubal blockage per se, but what they do is that they can cause what we call peritubal adhesions. Again, if you go back to that video, it's around the tubes, you see some spider web kind of stuff there. Those things are what we call adhesions that can affect, but endometriosis do not necessarily block your tubes directly at all, but they can affect tissues around the tubes to the extent that they can compromise tubal function. Yes, they don't cause blockage of the uterus or the womb at all.
All right, sir. Thank you so much. So we can see so many. Thank you, thank you, thank you, thank you, everyone, for thanking Dr. Yakub for his time. Jessica says, "I learned a lot. Thank you very much for this opportunity." Well Life Foundation. Joyce says, "Thank you, sir, for the amazing presentation." Hadiza says, "Great presentation, Doc. Very enlightening." Frida was amazing presentation. Thank you, ladies and gentlemen, for your time. Thank you, sir, for once again doing justice, taking your time to enlighten us on the topic of endometriosis. I want to
It's
believe
nice.
that in one way or the other, we've been enlightened. And most importantly, I want to encourage each and every one of us who have been here tonight to spread the word. Now you are more enlightened and you can help a sister in need around you. So, this knowledge is not just for you alone, it is for those around you. All right, we are gradually drawing the curtains on tonight's health talks. I want to appreciate everyone that has shown up, from our health talks 1 to our health talks 2 and to our health talks 3. This is not the end. It can only get better. I want to give you a just a little snippet. Our next health talks is going to be super incredible. So just start gearing up for it because we're going to be having an amazing time. It is going to be a panel discussion and we are going to be discussing a very juicy topic. I won't let the cat out of the bag today, but just prepare yourself for an incredible time. This time, our doctor is going to be joined by his other colleagues to discuss a very, very, very interesting topic that affects us in our generation today. And don't worry, we have your email addresses. Please always keep an eye on your email. Whether you sign up for a particular health talks or not, we have you in our database and we will always share very good information with you to join our health talks. Once again, my name is Christine Vihishima, Programs Officer at World Life Foundation. It was a pleasure to do this again with you tonight, and I am looking forward to seeing you next time. Please don't come alone. Let's double our numbers, let's triple our numbers. Okay, when you get the emails, feel free to share it with your friends and family so they can join us. Sir, once again, on behalf of myself, World Life Foundation, and everyone on the live, we say thank you for always giving us your best.
You're
We are truly
most
grateful.
welcome, Christine. Most welcome.
Thank you,
And we
sir.
appreciate everyone who has participated today. Yeah, we hope we have learned something today. All right. That's our
We
goal.
have, we can
Thank
assure
you.
you. Thank
All
you,
right.
sir. All right. Thanks, guys. Thank you so much for showing up, and we look forward to seeing you again. Good night.